Thank you, Mr. Speaker. When Alberta Health Services announced that 69 Albertans had died from fentanyl in the first 3 months of this year, it became crystal clear that this crisis is not subsiding. 5 weeks ago, BC declared a public health emergency because its opioid-related deaths are escalating, yet Alberta has refused to take the same measure. To the Health Minister, your government has taken my advice about funding Alert, making naloxone more widely available, and regulating pill presses. Will you now accept more of my advice and declare this a public health crisis?
The Honourable Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. And to echo the statements from the Minister of Health, our hearts really do go out to the families and communities dealing with the heartbreak and tragedy of drug addiction. We have been listening to our health officials, and they are saying that we do not need to take the step of a public health emergency. They have access to all of the resources and the tools that they need to address this concern. Other provinces have different legislation and need to declare a public health emergency simply to give their public health officers the tools that our officers already have today. Frankly,
Mr. Speaker, given that Alberta's internal data collection is likely different than BC's, and declaring a public health crisis might make no difference on a strictly administrative level, but given that there are other reasons for declaring a public health crisis, such as raising more public awareness about the serious hazard, again to the Health Minister, how can creating more awareness about a crisis ever be considered unnecessary?
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. Our team is working very hard around the awareness issue with a number of public information campaigns, including the Drugs Fool campaign, as well as others that we're developing in partnership with our partners in law enforcement. To be clear, in Alberta, under Alberta's Public Health Act, a public health emergency grasps the Minister of Health and Chief Medical Officer extraordinary powers designed to specifically stop a major outbreak of a communicable disease, including quarantining people against their wishes, seizing private property, entering into private homes without a warrant, and even conscription of Alberta into service. We do not believe that that is
Thank
an
you,
appropriate...
Honourable Minister. Second supplementary.
Yeah, we're not talking about incarcerating people. We're just trying to make this more aware. Thank you, Mr. Speaker. Given that this government acknowledges the seriousness of fentanyl in W18 as a problem, and given that public wants certainty that its government will create a comprehensive strategy for dealing with this crisis, and given the effectiveness of the Mental Health Review Committee, which was created to offer advice to the Health Minister, to the same Minister, will you establish a similar opioid abuse advisory committee to deal with this health crisis?
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. As the member mentioned, the Mental Health Review Panel did examine this problem of addictions and made a number of recommendations specifically related to opioid addiction. And in addition to the work that we've done out of that, we're also working very closely with our Indigenous partners to create an opioid strategy, particularly for our First Nation, Métis, and Inuit communities. All of the recommendations are in the Mental Health Review, and we have teams responsible for implementing 6 priority recommendations of the review. I look forward to continuing to work with the member opposite as we take real action on this issue.